are with our patient Rob. Rob stopped by the office today after about a 3-year hiatus. He did a MaxHarvest procedure 3 years ago, and he just happened to be in town and let us take a look at how the results came out. How was the process for you, my friend?
Well, the process was simple, Simon. I mean, it really was. Dr. Bolton and his staff was absolutely terrific, but I'm thrilled with the results.
That's amazing.
For me.
That's amazing.
Yeah.
Okay, and it was the crown that bothered you.
Correct.
And it always bothered you that you had no hair in the back.
Right. right.
So you said, hey, I want to get this fixed.
Right.
And this is a pretty common thing. It doesn't matter whether you're 18 years old or, you know, a little bit above 18 years old. When you have hair loss,
right.
It's not uncommon that I get patients your age. I get them older than you all the time.
And that's
can
part
Can
of
I say your age?
Well, sure.
So how old are you?
I'm going to be 70 this year.
7 years old. So I do patients, no exaggeration, in their 80s relatively frequently. And they all have the same answer. I just don't like how I look.
And that really is the truth, Dr. Bolton, because because this was 3 years ago, that I really sort of kind of hesitated, thinking my age, you know, why bother? But that was really a wash, because once I did it and decided to do it, I feel so much better than I did. I wish I did it actually long ago.
Awesome.
But Dr. Bolton wasn't there then, so but now that he is, I mean, I'm thrilled.
Awesome,
thrilled in a lot of ways.
Awesome. So no pain during the process.
No, not at all.
No unusual healing. Everything went well.
Yes,
all right,
absolutely.
I'm just going to kind of show you off a little bit.
Sure.
So we did the crown and did what's called a MaxHarvest, where we move as much hair as we can from one side to the other. And this whole area was just a big empty spot.
That's
so
right.
we went through, built a beautiful spiral, filled it in all the way around. We did a nice size case. I don't know. I'm gonna you can just hold your head regularly.
Okay.
I'm gonna kind of show where the scar is. So when we do the MaxHarvest, we take all the way from over here, okay? And I always see the scar at the first time as the camera does. And look at that. That's the scar right there. You see that little line right through there? That little line is the scar. He healed absolutely beautifully, okay? And I just kind of follow it around. There you go. There's a nice, right there. See a tiny little trace line? Can you see that in the camera? Okay. This is what a suture line looks like. It's just this tiny little line. It's all it is. So as long as the patient follows their instructions and does what they're supposed to do, that's all they should expect, is a little undetectable suture line. And perfect scar. Just as good as it gets, my man.
I would agree.
And the back is just filled in nicely for a one procedure result. You know, in a perfect world, we always would like to have a second procedure on a patient, but he's happy. He doesn't want any more. And that's as good as it gets.
That it does. And, you know, and I have to tell people that are listening or watching, I should say, that really it's not only as easy as Dr. Bolton says that it is, but it's painless, and the results are just fantastic. And that's what I think every patient wants, is results, and they're there.
Well, that's awesome, man.
Yeah, absolutely.
And for the guy who's sitting at home watching this, what would you say to him waiting around?
Don't hesitate, pick up the phone. Call Dr. Bolton.
Congratulations.
Okay, thank you, Doctor.
I appreciate you coming
not
in.
a problem
You look
at all.
awesome.
Well, thank you, I appreciate
it.
that.
And thanks for doing the video.
All right, bye guys.